Hi, my name is Dr. Harold Kim. I'm an allergist in Kitchener, Ontario and London, Ontario. And the following information you're going to see is actually meant for my patients that we take care of in our clinics. But if you're using the information for yourself, it should be used under the management of your physician. Often we see patients that have nasal symptoms from allergies and asthma as well. Using this technique, especially in children, but even in adults, we might be able to help the nasal symptoms and the lung symptoms by using just the asthma inhaler and not having to use the nasal spray as well. There have been studies to suggest that this works. The way to do this is you would have your asthma inhaler, and this would be an inhaler that would have been prescribed by your physician. And we have an inhaled steroid. This one is Alvesco, but you could have Qvar or Flovent. Those are inhaled steroids as well. You take the puffer, you shake it, and you put it in a pediatric aero chamber. And this is an aero chamber that has a mouthpiece on it. And this part will also go over your nose. So the idea is you'll puff this and you inhale through your nose, in through and all the way down into your lungs. So you'll get some of the medication deposited in the nose and then the rest of the medication deposited in the lungs. It's quite an effective way to decrease medication exposure. So you have it in the aero chamber, okay? You shake it, then you put your mouth in here with your nose in the nasal section, and you breathe in through the nose and hold your breath. So you shake, and then you put it over, and then puff, and then in through the nose. Puff. So what you've done is you've delivered some of the medication in your nose and into the lungs. And what we find is that you'll have your nasal symptoms and your asthma symptoms improve, but not requiring an extra nasal steroid spray as well. Just a warning that this is an off-label use of using the inhaler. This is officially meant just for asthma. But again, because there's science to support this, and of course it makes sense to do it this way, and the drugs that we use in the asthma inhalers are the same steroids that we use in nasal sprays, so it really makes sense to do it this way. Typically we do it in kids, as I've mentioned. They have to have the ability to control the breathing through the nose. But you can also do this with adults as well. But then you'd have to prescribe an aero chamber with a mask for adults. And again, you'll help both the nose and the lungs. So again, an unorthodox way of delivering medication to nose and lungs, but a nice, useful way to do it and recommended by myself often to patients. Thank you.